right. Welcome and good evening to everyone. I'm pleased to have you join us for the Nursing Unit Assistant Certificate Program information session. I wanted to point out that on our welcome slide is a picture of a past NUA graduate with one of our instructors at Kelowna General Hospital. So that's kind of neat. I wanted to introduce you to our panel. We just have a small panel this evening. So my name is Cindy Meisner. I have been with Continuing Studies and Corporate Training at Okanagan College for the past 23 years. In my current role as program coordinator, I enjoy assisting adult learners like yourselves with educational opportunities in support of your career goals. I credit my incredible colleagues, some on this panel, for making Okanagan College a better place to work and learn. I've been involved in the NUA program throughout my entire career with Okanagan College. So today we have three of us, all from Okanagan College. So joining myself as co-host is Jill Headland, who's the program coordinator from the Penticton campus. She did the wave. And also joining us is Natalie Mann, one of our NUA instructors. We will take turns presenting throughout the webinar and covering the following areas. So we have a bit of an agenda. So we're going to talk about the rewards of an NUA career, do a program overview, and then review each of the NUA modules so you have a better understanding of what is covered in a NUA position. And then we'll talk about employment opportunities, next steps, and there's always time for questions. So this webinar is set up so that you can type questions in the Q&A box. We welcome you to ask questions during our presentation, and we will answer relevant questions during our specific topics. Some we may save to the end to answer if they're not relevant to what we are discussing, but we will hang on to those. The Q&A box is actually a fantastic tool in webinars. So please note that we are recording this webinar, and we will provide a link to all attendees and then to those who are unable to make it. And that way you can refer back to it, or you can share it with a friend who maybe wasn't able to join tonight. Our goal today is to help you understand more about the Nursing Unit Assistant Certificate Program and provide insight into why you might want to work as an NUA in the rewarding healthcare field. So, rewards of an NUA career. At this time, I would like to introduce you to Natalie Mann. Natalie has been supervising practicums and teaching for us in the Nursing Unit Assistant Program for the past 3 years. And she has been a Nursing Unit Assistant at Vernon Jubilee Hospital for over 14 years and a year previous to that at Fraser Valley. Natalie will now share the rewards of being an NUA.
Thank you, Cindy. Thank you for everybody for joining us tonight. I think the biggest question that we often get is, what does an NUA actually do? And a lot of people who are in the program are also unaware of that. As an NUA, we are the multitasker of the unit. We're the one who's taking care of the nurses and doctors, the staff who are providing clinical hands-on care, and we are the ones who are doing all the administrative tasks to allow them to do their job more easily and more efficiently. The rewarding part of it for me is I'm part of a team. I'm part of an essential healthcare team, an integral part of it. And it is always challenging. It is always interesting, and you're constantly learning throughout your position as an NUA at the hospital. Also a very diverse work environment in many different units you can work on. So you can challenge yourselves in different ways all the time.
Awesome. Thanks, Natalie. So a quick program overview. So we offer the Nursing Unit Assistant Certificate Program at 3 campuses, so Vernon, Kelowna, and Penticton. And we have ongoing support and collaboration with our local hospitals for practicum placements at each of those. The program runs part-time from September to May, with a few different instructors teaching the 9 different modules. Classes are generally 2 evenings a week and Saturdays. Due to COVID, we offered the program online this past fall, with some of the class time virtual, some of the time assigned independent work and reading, and then some of the time instructors were available for online office hours. Each instructor will advise you of their schedule for their online lectures and their office hours before you begin each new module. Luckily this year, at the end of January, we started to hold our Saturday classes at each of our campuses. And that allowed us to instruct Meditech training and ensure that students were ready for practicum placements coming up this spring. At this point, Okanagan College hasn't made a formal decision as to how this program will be offered this fall. We plan to advise all our applicants and our registrants how the program will be offered by later this spring. One option is that we will offer the program the same way as we have been this past year. And that would be online theory for 2 evenings a week and then Saturdays on campus. So tuition is just over $5,500. Textbooks and materials are approximately $260. And please note that unfortunately this program is not eligible for student loans at this time. So next we will review each of the individual modules of the program. So Natalie will lead us through that part of the presentation.
Perfect, thank you. So as Cindy said, the program is broken into modules, and basically each module is a topic. And every topic that is taught through this program directly relates to the job you will be doing as an NUA at the end. So the first one you start off with is medical terminology, MOA 101, and it's a 72-hour course, and it's essentially teaching you the medical terminology that goes along with working in the medical field. So it's teaching you what the technical names are for body parts, for positioning, and all of those related items. So it's teaching you the all-encompassing definitions for body parts so that you can understand what you're being told once you're in the hospital and what exams you're ordering. And then the next module there is NUA 100. So that's your communication skills. This is a bit of a shorter module. In this one, we're learning about communication skills within the hospital, but also how to become a more effective and efficient communicator just generally in life. So you will be going over hospital-specific things such as phone systems, pagers, how to get a hold of doctors, but also just how learning a bit more about how we communicate and how we can communicate the most effectively with others. The next module there is NUA 110, and that's patient chart records. Every patient who comes into a hospital does have a chart that has all of their information relating to that visit. So this module is about how to assemble that chart and how to take it apart and where everything belongs within that chart. Then we have NUA 120, admissions, transfers, and discharges. This is dealing with the technical portion of how a patient is actually admitted to hospital, how they move about the hospital from a computer standpoint, how we change their room, change their service, whether they're a medical patient or a surgical patient. And then once they leave the hospital, how the administrative side of that is done. After that, we have pharmacology, and pharmacology is all about learning about medications, medication names and how they're given and how they're administered to patients. And then the next one is processing medical orders. So after we've learned about what those medical terms are, what those medication names are, how they're given, the next module here, NUA 140, is about how to actually make sure that the nursing staff is aware of how those medications need to be given. So how we translate it from what the doctor has ordered to what the nursing staff receives. The next one is processing laboratory orders. So these are orders that go through the lab. So blood draws, how they're analyzed, what they are, and how we as NUAs make sure that, again, that goes from what a doctor has ordered to how the lab actually processes it. Next one is diagnostic orders. So diagnostic orders are things like x-rays or CT scans or MRIs. So same kind of idea as the previous modules. What we're doing here as NUAs is we're taking the information that the doctor has given, the orders that the doctor has written, and how we're making sure we communicate that to the appropriate departments so that those tests that the doctors are ordering are actually happening for the patients. And then processing interventional orders, NUA 170. That module is about, again, reviewing the admissions, reviewing surgical care or post-surgical care and discharges, but also other practitioners that may be involved with a patient during their hospital stay, such as physiotherapy, occupational therapy, and how we communicate to them what the doctor is requiring to be done for the patient during their hospital stay. And then the final module within the nursing unit assistant program is the practicum. So the practicum is where you're taking all that classroom learning and you're actually putting it into effect. So during this time, you will be placed in the hospital with an NUA, and you will have time with them to learn the hands-on part of the job. So taking, again, like I said, all of that information that you've learned throughout the year and putting it into practice.
Awesome. Thanks so much, Natalie. That was great. So we'll take a quick break from our information because that definitely was very thorough. And I'll do another poll question. Some of you maybe weren't online when we did our first one. So here is, let's see. I'll launch it now. So we'll just take a couple minutes here to see where everybody resides, and we'll have a better idea which areas you're looking at applying to for the program. Okay, it looks like everybody has answered. So here's the results. There's a couple of you from the Kelowna area, a couple from the Penticton area, and one from the Vernon area. So that's awesome. That gives us a good idea of where people are coming from. So the next item on our agenda is employment opportunities. So Okanagan College is very pleased to be working with our local hospitals in Seminar, Vernon, Kelowna, and Penticton for practicum placements. We've also worked with the Royal Inland Hospital in Kamloops in the past for placements as well. I'm happy to report that a lot of our grads have been receiving jobs at the end of their program over the past couple of years. I understand that there's a number of potential retirements projected in the coming years, so that will open up any more opportunities for our future grads coming up. So, Natalie, is there anything else you wanted to add on that?
I was just going to say, Cindy, that's absolutely correct. We do have a lot of people that will be moving on and retiring within the next few years. And as I kind of said before, as anyways, we're doing the administrative work so that the nurses can have more time to do their actual clinical hands-on care. So anyway, jobs are constantly being created as well. They're finding them more and more need for those administrative roles. And also within hospitals, anyways, work on the nursing units, but there's also outpatient clinics, and there's cardiopulmonary, and there's many other areas that need that administrative help. So within a hospital, there's so many opportunities for NUAs that already exist, but that will be created in the future as well.
Good points. That's great. And the one thing that I'll point out at the bottom of this slide is a positive practicum experience will positively impact your employment opportunities. And we can't remind students enough about that. Doing a practicum experience is almost like having a hands-on live job interview. And so many students, that is how they're hired, is based on their recommendation from their practicum experience. So it's something to keep in mind throughout the program, and then definitely when you are in practicum placement. So.
We've got a question here. I wonder whether Natalie, sorry, could speak to this now. Charity's asked what kind of hours, so the kind of shift patterns, I guess that would be.
Absolutely. Huge variety of shift options. Hospitals are open 24 hours a day. So we do have many, many options. At this point in time, I can't speak to Kelowna just because I don't know as well, but in Vernon, the only unit that has 24-hour day shifts is the emergency department. But every other department in the hospital, it ranges between 6-hour shifts, 8-hour shifts, and 12-hour shifts. And they can start anywhere from 7 in the morning, ending at 11:30 at night. So the great part about a practicum, and when you first started, you can try out many different areas within the hospital and find what works for you. If you're looking for Monday through Friday employment, there's obviously opportunities for that. But if you're looking for more evenings, weekends, or nights, those are also options that you could have too.
Awesome. Charity, does that answer your question? Or if you need anything else, just maybe pop another. Okay, perfect. Thank you. So on to next steps. So thanks very much, Natalie, for all that great information. So next steps for anyone interested in the program is to apply to the program just off of our main page, apply at OC. And the one thing to keep in mind is we have a limited number of practicum placements available for each regional hospital. So your practicum location is determined by the campus you apply to and the hospital located near that campus. So if you're applying to Vernon, then your placement would be at the Vernon Jubilee Hospital. We also take applications and place students at the Shuswap Hospital in Salmon Arm. And then if you're applying to the Kelowna campus, your practicum would be at the Kelowna General Hospital. And then again, if you apply to Penticton campus, your practicum would be at the Penticton Regional Hospital. So as I mentioned earlier, for practicums at either Kamloops or Salmon Arm, you would please apply to the Vernon campus and then just inform us of your practicum preference at either of those locations, and then we'll be able to expedite your application. And so the next step after applying is you would meet the admission requirements. You'll receive an email which will inform you of what the admission requirements are, which are here on the screen. So high school graduation and or minimum 19 years of age. And then we do need an English 12 with a minimum of 60%, or you can write a different equivalency for that if that's something that you don't have. You also have to provide negative tuberculin test results. And eventually, as we get closer to the program start date, then we will ask you to do a criminal record check, not at the RCMP station. So wait until we send you the info because we tell you exactly where to request the CRC from. Okay, so that's step 2. And then once you have met those prerequisites and you have been offered a seat in the program, then at that point you're asked to pay your non-refundable deposit of $200 and you'll be registered into the program. And then following that, your payment dates for your tuition are approximately $1,500 due in mid-August and about $3,800 due mid-December. So what I've done is I've actually put the 3 different campus and the contacts at the 3 different campuses. So if you're inquiring about a specific campus, then you can contact either Jill or myself or Chrissy. And also the program assistants are listed there as well. They can actually assist with questions too. All right. You guys are a quieter bunch than we're used to, not many questions, so you don't have to check the box. So any further questions that maybe we haven't answered yet, we'll definitely take those now. I wanted to conclude our presentation, and on behalf of Natalie, Jill, and myself, we want to thank you so much for attending our nursing unit assistant information session. If any questions come up later on, we're welcome you to reach out to any contacts listed on the slide. We will be around for a few more minutes, so if you want to ask any specific questions, we'll stay around and answer that. Just let us know in the question and answer box. And for those of you that have to go, we wish you a wonderful evening. Thank you. And I see we do. Yeah,
So,
go ahead, Jill.
I was going to say, we do have a question about the starting wage, which Natalie maybe has some ideas about that.
Yes, so the wage is a standard wage. I'm sorry, I don't have the exact dollar figure, but I believe it's just under $24 an hour at this point in time. We do get periodic raises once a year in April, and then depending on the shift you work, you're also available to get shift differentials, they call it. So if you're working an evening or a weekend, there is an extra bit of wage that will be attached to your pay.
Excellent question, Lara. Thank you. Is there a minimum enrollment for this program? We do have a minimum enrollment for sure. We typically do fill our programs at each of the campuses. I know for the Vernon program, we are either full or very close to full, but I know there still is room at the Kelowna and Penticton campuses at this time. So I would encourage you to apply as soon as possible and then get your admission requirements in very quickly.
Yeah, and for the Penticton campus, I think we actually have the smallest cohort of the three campuses, because there are all of our programs, all of our campuses are limited by the number of practical spots that we can find at the hospital. So we have 10 seats in Penticton. That's our maximum, and we do fill. But yes, as Sydney said, there are still seats at the moment, but only 10. So get in there now.
Awesome. So Vanessa is asking, can the practicum be part-time? That's a good question. Natalie, do you want to take a?
Yes, absolutely. We work with you and your schedule. We do understand that people have to work and you have to make money and have an income to survive in this world. So we do our best to work around what you have as available. I always strongly recommend to the students to make themselves as available as possible for their practicum so that they can get through it as quickly as possible and get hired and start working. Generally speaking, with that 125-hour practicum, if I have full-time availability to work with, I can get you through it in under a month, in about 3.5 weeks. Whereas if we're working with part-time, obviously that's going to be stretched out over a longer time period, which means your date of hire will be pushed back as well.
Now, Lara's asking, does this job include a lot of math?
That's a good one.
I think the most complex math you have to do is figuring out the time of day. So usually with times on the clock, because we work in 24-hour time, and then very, very simple math if you have to do any though. So the most important part of the job is attention to detail and accuracy. Those are the things that are going to be the most important for you.
That's a great response, Natalie. So Lee is asking, is it reasonable to start this career at 53? And I would say absolutely yes. We have many mature students, definitely not the majority of the class, especially in the later years that I've seen, but that maturity level is around my age. So I definitely can say we've had students, I would say, in all of the cohorts at every campus. And you're never too young to learn anything new and to try a different career. I'm all for that. And Natalie, can you speak to that just from your experience with other
Absolutely. Yeah, I agree with you, Cindy, completely. I've had definitely students that are of that mature age and they do wonderfully. And life experience means a lot sometimes. So it's never too late to start if it's something you're interested in.
Great questions. They just saved them all to the end. we'll give you just a couple more minutes. If you do have to leave, feel free. Natalie, here's another one for you. How likely am I to get hired after my practicum?
Honestly, a lot of it, like like Cindy had said before, was your practicum plays a huge part in that. It is essentially a 125-hour job interview. The majority of my students have gotten hired right away, the ones who were motivated to, because there's always options. Now, having said that, you will not be hired into a full-time position right away. Generally speaking, an NUA or any healthcare worker position starts off as what's called a casual position, which means you're hired to the hospital, you're oriented to a few units, and you start working, filling in sick calls and vacations and those sorts of things. A lot of it's pre-booked, and you work as much as you're willing and available to. And then as time goes on, as you develop a little bit of seniority and experience, then you will get a permanent position. So I don't know if that answers the question that you were looking for.
And then the next question is, can one work in senior homes?
So yes, absolutely. We, as in Vernon anyways, we do have a few long-term care facilities that are under the IH umbrella. So there will be NUA positions at those facilities. So in Vernon in particular, we have Polson and we have Gateby and we have Norrick House, which are all long-term care facilities. So they're people who need more assistance, and they do have NUA positions at those facilities.
And Lee is wondering, what is the hardest part of the job?
I think the hardest part of the job is keeping control amongst the chaos. There's a lot of times where the job is very predictable, but the majority of the time it is very unpredictable. So it's just learning how to multitask and how to prioritize your tasks. That's, I think, the most challenging thing that people have to work through.
I think that could apply to a lot of jobs.
Yeah, exactly.
And Lee's wondering, how long does it usually take to become permanent?
You know, it's really hard to quantitate that because it really just depends on what's going on in the hospital at the time. Generally speaking, I find that most people within about a year or so can get their hands on some sort of permanent position. It's usually a part-time position, but there's always additional hours to bump up your schedule to more full-time. And just to add to that, sorry, I just want to say, I think the best part about getting hired right away and being casual is you have the opportunity to try out so many places within the hospital. You can work on many different floors and in many different areas and really find what you enjoy before you commit yourself to a permanent position.
Oh, that's a great point. Yeah.
Mm-hmm.
And Lara's wondering, what is your favorite part about the job?
My favorite part about job is my team. It's my people that I work with. I work in the emergency department in Vernon, and I very much feel like I'm an essential part of that team. And I work with amazingly intelligent and talented people who are very caring. And yeah, it's the people. It's the people that I work with that I love the most.
And I think that applies to a lot of other places as well. So. Vanessa, sorry, I missed the part about how many spots are left in the Kelowna campus to apply for September. I'm not exactly sure on how many spots are left. I know that there were spaces available. It also depends how many people have applied before you and may have offers, but I know right now there are some spaces available. So if that is something that you're looking at, I'd encourage you to apply right away and then work on your admission requirements. And once you get that first email after you apply, you'll have a contact name and phone number that you can connect with, or I would encourage you to connect with Chrissy or Terry, and their emails are on the screen right now. And Lara's asking, what kinds of different units are there? Wow, these are great questions.
Yeah. So depending on which, Laura, which site would you be at? Which town are you in?
You can actually unmute.
Vernon. Okay, perfect. Because I know a lot about Vernon. So depending on where you are, there's going to be bigger hospitals and smaller hospitals, obviously. So in Vernon, we have a fair size hospital. So there are units like inpatient units where patients are staying in the hospital. So you have medical units, surgical units, ICU, women's and children's, emergency department, mental health. I think those are kind of cover the main ones within Vernon Hospital, but there are also NUA positions in cardiopulmonary, which is respiratory, in diagnostic imaging, in the outpatient department, in the post-anesthetic recovery room, in the operating room, in surgical daycare. So as you can see, there's many, many different positions. There's also the fact that once you have an NUA position, or sorry, an NUA certificate, you can also work in departments like admitting or patient registration. And there are other areas that you can apply those skills to as well that aren't necessarily NUA positions, but they do have a lot of the same roles and require kind of the same prerequisites to have them.
Awesome. I'll just give you a couple more minutes just in case there's any other questions. I can stop sharing now. You're so welcome, Charity. Thank you so much for joining us. Is English the only high school course I need to join this program? Yes, English is the only required course, mostly because of how difficult medical terminology can be, that you need to have a strong English background, and then also for communication. It's not a high percentage that you have to have, but the reason for it is because of the difficulty of medical terminology and being able to be successful in the program. You're welcome, Vanessa. Have a great night. You're welcome, Lee. Oh, Lara missed our answer about math being involved in the job.
Right, and yeah, the math is not a large part of the job. It'd be very simple things like figuring out timing of, you know, doing tests every 6 hours or something of the sort. So it's not any calculations really that you'd have to worry about.
You're welcome, Lee. Have a good evening.